Previously, doctors often struggled to accurately assess the progression and severity of cancer in individual patients, making it challenging to prescribe effective treatment. According to the Executive Director of the Uganda Cancer Institute, Dr. Jackson Orem, the introduction of cutting-edge diagnostics and innovative treatments, such as targeted radionuclide therapy, addresses the limitations of traditional cancer treatment.
Is that this is going to improve the way we treat cancer at the level of an individual. We call it personalized treatment. That means that even though you have two people who have one type of cancer, because they're different individuals, they can be treated differently. And in order for us to do that, we need actually to use isotopes, which we are setting up here. And then secondly, we are saying that this is part of a broader program we call the PET project, where we want to have, at the end of the day, a fully fledged molecular imaging which includes PET.
Dr. Godfrey Sinde, the head of the Nuclear Imaging Division at Uganda Cancer Institute, sheds light on how the newly acquired SPECT-CT machine, a multi-billion shilling investment by the Ugandan government, will enhance cancer treatment by enabling medical experts to prescribe targeted and effective medications.
So when we get some of these substances that are being released by the cancers, around now we're going to use as the vehicle to look for these particular cancers where they are, to monitor them. Now, I'll give an example, still with the prostate cancer. It can cross to the bones, but when it crosses to the bones, it will still be releasing this tumor marker, the one which can mark it. So now when we get this vehicle and we inject in this person, in this case, it will even go to the bone, meaning that the cancer has gone to the bones. If it has, it will follow where that vehicle is. So this one is now very specific than previously, where you only focus on the prostate, and by the time you reach the bones, you're not so sure whether it is that cancer or another cancer that has gone to the bones. So it makes it more personalized and very specific.
When questioned about the cost of this personalized treatment for Ugandans, Dr. Orem emphasized that the government's primary focus is on ensuring that these services are accessible and affordable for all.
Our aim is access.
Access. So
the first thing we need, this facility must be there. And then, of course, issues of cost will come in. As we know, the policy of our government is to make sure that people get treated irrespective of their status. So that means that is going to be the number one. Once the facility is there, everything is there, the issues of cost now can be discussed. But what we are saying is that even if cost is there, it's going to be the bare minimum.
yeah. And most likely we shall give it free of charge, because our target, we are getting a encapsulation machine. We shall be able to do the compounding and ration the dose from here. Because you see, to import one dose is leading you to spend about that $2,000–$3,000. But if we go a bulk importation, we can lower the cost of this dose to $100 or $200. That means the whole service can be just given, the government can fund that treatment, because that treatment, I mean the thyroid cancer, is really non-responsive to other modalities, and it can only now respond to this way.
Dr. Henry Dungu, a senior hematology and oncology consultant, urged the public to seek medical attention promptly upon detecting cancer symptoms, emphasizing the importance of early diagnosis and management.
Naddala nga abantu bongedde okumanya, first of all, okwewala endwadde, ekyokubiri okuzizula nga bukyali, kituyambe nti tukakasa nti obulwadde bukoma wano ne tubujjanjaba n'eddagala etuli.
According to a recent study by the Uganda Cancer Institute, approximately 72,000 cancer cases are reported in the country each year, comprising of 36,000 new cases. Notably, the study found that a staggering 80% of these new cases result in 2 fatalities within just 1 year. Joseph Kabale, UCTV News.